I take your point on board that MRI is not necessarily sensitive and specific enough for CLPS, but what I would say is that when patients present with those sort of symptoms, those are also fairly non-specific symptoms, except for the Barnwell cases. In early cases of CLPS, it can be quite non-specific, and I think the access to bone scintigraphy in most places is quite limited compared to MRI, which is far, far more widely available. So whilst I take your point on board, I think often in many cases you will have an MRI as your first line of diagnosis. And there are some features on the MRI that would point you towards CLPS as being a diagnosis. So for example, if you did see widespread bone marrow edema-like signal, soft tissue thickening, in the absence of any features of infection, etc., then I certainly would raise that as a differential within my report. Of course, the clinical features then have to tie in with that. So I would say that certainly, I don't know what your access is to nuclear medicine over here, but MRI doesn't have any contrast, so no IV access required. It's fairly quick. I think there's good availability generally in Pakistan. You can get to an MRI scan. I don't know about bone scintigraphy. So I think it's still something that people should consider. It's certainly better than doing a CT scan, for example.
I mentioned even a cheaper room. Yeah, which is